Initiation of mechanical ventilation. Mechanical ventilation is a complex mix of advanced biomedical equipment and advanced physiological knowledge. Knowing the indications for mechanical ventilation is the first step in the initiation process. A review of the chart or the medical record, according to the site policy and procedure at which you're rotating, is required prior to starting mechanical ventilation. Follow infection control procedures, including the thorough washing of hands and the donning of gloves prior to the initiation of mechanical ventilation. Carefully choose the ventilator according to its capabilities, which may include but are not limited to modes for both invasive and non-invasive ventilation, portability, battery backup, the presence of a compressor, and graphical display. Identify the patient, yourself, the department that you represent, and your role as a respiratory therapy student at NBCC SJ. Follow the pre-use check according to the manufacturer's specification or the local policy and procedure at the site in which you are rotating, which can be found in the Policy and Procedure Manual. Where possible, preset mechanical ventilation parameters according to the patient's ideal body weight and the issue for which they are being ventilated. This generally falls into the categories of oxygenation issues, ventilation issues, or airway maintenance issues. Alarms on mechanical ventilators should also be set according to what's available and the capabilities of the individual machine. All alarms should be set at reasonable values, with simple guidelines of high pressure limit of 50 centimeters of water, low inspiratory pressure where available halfway between baseline and peak inspiratory pressure, and low tidal volume alarms approximately 15% below what's anticipated. Mechanical ventilator initiation starts with the patient being manually ventilated. Ensure that the mechanical ventilator has been turned on, and then simply attach the interface of the circuit and the endotracheal tube together, and quickly observe for chest rise, the development of pressure and/or volume in the mechanical ventilator circuit. This may be done by quickly evaluating the scalars where possible, or by looking at the pressure manometer on the ventilator. A quick auscultation of the patient over the chest fields and the epigastric area is warranted at this time. Position the circuit appropriately and establish any bedside monitoring that is required, such as end-tidal CO2 and oximetry. Observe the patient for any unfavorable signs and symptoms and react quickly and appropriately to the alarm conditions that are presented. Ensure equipment such as airway supplies and resuscitation bags are properly placed and attached at the bedside according to the local site policy and procedure. It is at this point that documentation and recording of values can occur according to the site policy and procedure. Please ensure that all personnel are notified appropriately. Mechanical ventilation is part anatomy, part physiology, and part technology. By combining all of the aspects in this video, it is anticipated that the initiation of mechanical ventilation will be performed in a competent and safe manner.